Good morning. Good morning, everybody. Can you hear me?
Yes, Miss. Good morning.
So, do you have any doubt from last class? Did you practice facial massage? Did you practice facial massage? So, do you have any doubt? Or we'll go to the next. Answer something so that I can know that you are there. Okay. So, I have just updated the slides little bit. So I'll upload this slide in LMS now. And like previously, I tried to upload our class recording, but I was not able to do. So today I will send it in another platform. Okay, so uh, already we have finished 2 classes plus today's class recording. All together 3 I will upload by today. Is that clear? So like if I'm not able to upload in LMS, I'll upload through other platform like previous. I think previous semester your representative used one platform, right? So in that I will upload by today. Okay. So this is the positioning for facial massage. So this is the patient position in supine lying. You have to make sure that the head is coming to the edge of the table or edge of the couch, and you have to clip all the hairs and other thing with a hair band. Then you can sit behind. It depends on the patient, the cot height. If the cot is like little lower, you can sit over. You can sit and you can proceed with that. If the cot height is not up to your up to the height, then you can sit. If the height is very tall, then you can stand behind the patient like this. So these are the two positions. Either you can sit, or sit means you cannot sit on the bed. You have to put a stool or chair, and you have to sit behind the bed. This is standing behind the patient. Okay. So I had a question. 1 minute. Okay. So effleurage, like we normally do 3 times. Other techniques, it is you need to cover up the whole area. So you can cover up and do, depending on the condition, you can do 3 times or 2 times like that. But everything is depending on the condition only. We don't have any set frequency. Even this effleurage 3 times also, it is not a set frequency. We are for the OSPE purpose, for the uniformity, we are keeping as 3 times. But normally it is just covering up the whole area. Okay, so for the OSPE, you can do all the conditions, you can do 3 times. For the other, like when you're treating the patient, it depends on the condition. You have to treat. You have to decide the frequency. Okay. So we will go to the back massage today. So this is the therapist position. for the back massage. So you have to stand at the side of the patient in a walk standing position. Is that clear? So this is the therapist position. So you have to stand in walk standing position so that you will be free to move around and walk to the other side. Okay, then you will be free to reach all the parts of the back. So that's why you need to stand in the walk standing position. If you are standing in normal position, normally you will be bending your back, that will be affecting your spine. Later you will be getting the back pain. So that's why you need to stand in a walk standing position. And in walk standing position, it is easy for you to transmit the body weight. So that is one more thing. Then, like, this is the patient position. So the patient will be in prone lying. So in prone lying, you can give, like last time you would have learnt about fundamental positioning. So in prone lying, you can keep a pillow and you can keep your hands like this and make the person to be in prone lying. And normally in a massage cot, you will be having an opening for the head so that the patient will be able to breathe normally. Okay, otherwise you can also make the person to turn the head to one side. So it's up to the patient whether they are able to lie down like this or they can lie down like this. So this is patient position. Then another thing is, like, you can also give them in sitting. So you can make them to sit like this and give back massage in sitting. So depending on the condition, you can choose the position of the patient in back massage. So position of the therapist is walk standing. Then other positions will be like, for lower limb, you can lower limb posterior side, you can make the person to be in prone lying. For the anterior side, you can make the patient in supine lying. Exactly. So that is for the upper limb. Okay, so for the back massage, these are the techniques normally we will be using it. But in case if you are if you want to add up anything, you can also add up. So it depends on the condition, what is the problem and why we want to give the massage. So in case if they have a lot of scar tissue, then you can go for more of skin rolling, picking up, bringing friction, all those things. So depends on the condition, you have to choose. If it is only for relaxation, then you can increase the kneading technique rather than other technique. So other than this techniques, you can also add up beating, pounding, compression. So all these techniques also can be added. So this is just guidelines for you. Depending on the condition of the patient only, you have to choose the techniques whichever you are going to do. Okay, so today I'll perform in the cot over the pillow. Then as like we have already seen the techniques, we are just going to see the we are just going to see the see how we are going to perform over a person. Okay, so techniques I have already taught you. I hope you would have practiced over a pillow. So now we are just going to see how you will be performed on a person in a complete sequence. So as we know, we have the sequence, like sorry, we have the steps. First, introduce yourself, then introduce yourself to the patient, then explain the problem to the patient. So explain what is the patient problem, explain what is the uh, what you are going to do, explain how it is going to help them. So these three things you have to explain. After that, you have to check for the contraindication. So since it is back massage, you have to check for the back contraindications. Then with that, you can go for, you can ask the person about the concern. So ask whether he's okay with undressing, because for back massage he has to undress. Then ask whether it is okay for him uh, for you to touch the patient. Okay, so this two concern you have to get it. After that, you have to position the patient. So positioning the patient, either like you have to position using a pillow like this. So you can position the patient like this in this position, use a pillow, or you can also make them to lie down with pillow under the abdomen. So under the abdomen, you can give this pillow and you can ask the patient to lie down. So these two questions you can do. After that, you have to make them to, you have to cover the lower part. So with the help of the towel, you have to cover the lower part. You have to tuck in the towel inside the pant. So that the pant is not getting spoiled with your lubricant. Is that clear? So you have to tuck in the towel inside the pant like this. Okay, so you have to tuck in like this. Is that clear? So you have to cover up the lower part, and you have to tuck in the towel under in the pant so that you don't spoil the pant. See why I am repeating all these things, because all these things will carry marks. Okay, then afterwards, this is getting ready for the patient, then getting ready of the therapist. You remove your watches, you remove your bangles, you remove your bracelets, then you have to see that you don't have nails, then you have to remove your rings and other things. Then after that, you can apply the powder. So you have to apply the powder down. So can you see? I hope you can see. So you apply the powder down to the patient, then don't dust the powder. Instead, you just make it like this. So when you make it like this, the powder will be all over the hand. Is that clear? So all over the hand. Then after that, you can start massage. You have to start the massage with touch. So you can just touch all over the patient body so that you are spreading the lubricant around the patient body. Then after touching, so you can either start from proximal to distal or distal to proximal. Then after that, you can come up, then you can start stroking. So stroking is just the fingers. So stroking is done so that the patient is getting used to your fingers. Is that clear? So from proximal to distal, you have to do the stroking. So the reverse, you will be just maintain the touch. So from proximal, you will do with a mild pressure. Then when you do the reverse, you will be just giving a you don't give any pressure, you just give a mild touch. So this is stroking. Okay, so you can start. You can you see, like you have to just cover up the area, then keep covering the complete area. Okay, so cover up the complete area. Then after that, you can start with effleurage. So effleurage is from below, you have to do, then drain. Okay, then come back, drain. So like this 3 times in one area, then go to the next area. Okay, go to the next area. Do 3 times, then go to the next area. So since it is back, you need to give 3 or 4 times depending on the size of the patient. Okay, so you can first you will do in the middle, then little bit side, then at the lateral side. So when you are doing effleurage over any bony prominence, so here in the back you will have bony prominence of the scapular. Okay, scapular blade will be here. So when you are doing over the bony prominence, you can reduce the pressure little bit. Is that clear? So you can reduce the pressure little bit. So when you are doing here, the pressure will be equal. Just over the bony prominence, you can reduce the pressure little bit, then you can drain. So this is effleurage. Then after effleurage, then you can just go with circular kneading. So you can do both the hands on either side, or you can also do on one side. so that you will be able to cover up the whole area. Then come to the other, then just go to the other, then do on other side. So you can use, depending on the area, you will be using different types of circular needing. Since for the back you can use both the hands, that is both the hands kneading. You can also go for finger kneading. Is that clear? So depending on if the patient is very bulky, then you can go for the double hands. If the patient is little bit small, you can go for single hand. You can also go for only finger. You can go for palm. Then if you want more pressure, you can reinforce and you can do the massage. Okay, so this is circular kneading. So after circular kneading, again go for effleurage. Okay, after circular kneading, again go for effleurage. Do three times and cover up the complete area. After that, go for skin rolling. So skin rolling, you will come back, then you will start the opposite. So what you can do is you can just pull up the skin, then roll. 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 So this will be little bit painful technique only, because this technique you are going to do to reduce the adhesion. So you have to break the adhesion. So it will be little painful. So just pull up and do. Then for the other side, you need to walk around. So you can just touch the patient or do compression or anything, walk around and come to the other side to do this, for doing this side. Okay, so normally skin rolling will be done from the opposite side. So from one side you will be doing that, then you will walk around and do the other side. So when you walk around, you need to still touch the patient and do. So you should not remove your hand. So that is skin rolling. So after skin rolling, again you can go for effleurage. Then you can go for picking up. So picking up can be done only in the lateral aspect, because picking up will be done only over the muscle. So you have to just do in the lateral aspect. So I'll just teach you here. Hold like this. Okay, then do picking up in the both the lateral aspect. So from below, can you see it? Is that clear? So this is for picking up. On one side you can do, then you can just touch and come to the other side. So both the sides you can do picking up. So after picking up, you can do once or twice. Then after that, again effleurage. After effleurage, you can go for friction. So friction is, once you come down, then you can just palpate the PSIS. Either you can palpate ASIS you will be palpating, then you can come posterior and palpate PSIS. On both the side you will be palpating PSIS. PSIS is posterior okay. Posterior superior iliac spine. So that is PSIS. So you have to palpate the PSIS, then bring the hand in the middle. So when you palpate the PSIS, it will be bulky, it will be prominent. Then when you come down and come in the middle, you will be reaching your S2 spine. Okay, so from that, you can palpate the spinous process, then give the circular kneading. Is that clear? So palpate the PSIS, bring your fingers along with the iliac spine. When you bring it along with the iliac spine, you will be touching the middle, that is your S2. So from S2, you can palpate the spinous process. Palpate the spinous process, then start the circular kneading. So over the spinous process, you have to give the circular kneading. Give the circular kneading, then go 1 centimeter above. Then do over the other. Then go 1 centimeter above. Then do this friction, circular friction over the other. So like that, every 1 centimeter up, you have to go and keep giving the circular kneading till your C6 spinous process. Is that clear? So from down, you will be coming up till C6, C6 spinous process. Then after that, you can either go for effleurage, or else you can come to the transverse friction. So from C6 spinous process, you come laterally and come little bit down. Okay, so come laterally and come little bit down. If you palpate, you can palpate the transverse process of C6. So in that transverse process, you can either go for transverse friction, either this way or perpendicular. So like that, then come 1 centimeter down. So keep giving over the transverse process 1 centimeter, 1 centimeter down, down, down. So don't just give it, you have to palpate the transverse process and then you have to give the transverse friction. So like that you can give it and come down. Then after that you can go for effleurage, then you can go for hacking. So hacking is using the tree. It is supination, pronation. Okay, so it is supination, pronation. So you can start hacking, then you can come down. So when you are giving hacking, you have to avoid over the kidney area. So normally the kidney will be present in the lower lateral aspect. So maybe you can avoid the lower lateral aspect on either side to avoid the kidney, because this hacking will be the pressure will go deeper, that may affect the kidney. So that's why you have to avoid the organs like spleen and kidney. Is that clear? So when you are giving at the lower, you need to either reduce the pressure or you can stop giving over the lower area. Okay, so this is hacking. So you can give hacking, you can give tapping. Okay, you can give vibration. So vibration will be like this. Okay, so you can give vibration, you can give shaking. Shaking is, so you can hold like this. When the patient is doing expiration, you have to give the shaking. Okay, so this is your shaking. So you can give shaking, you can give beating. So beating is this one. You can give beating, you can give pounding. Okay, so you can also give compression. Compression is like this. So either with both the hands together or separately. So you can give compression. Then okay, so except ringing, you will be able to give all other technique. Okay, so except ringing and tapping. So tapping is very mild one. So you can avoid tapping, because tapping is not going to give any effect on back massage, because it will be very mild. So except your tapping and ringing, you can do all other technique over the back. Is that clear? So to check what are the techniques to give. So for that you need to read the read the theory for the effects of each technique. So there will be like for each technique there will be effects and uses. So you need to read that, so that you will be able to uh, uh, choose the technique for the particular condition. So for example, skin rolling. Skin rolling helps to break the adhesion. So that means whenever the patient is having any adhesion like scar tissue or any other adhesion or any spasm, you will be able to choose this skin rolling to reduce the adhesion. Then friction will help you to reduce the adhesion. So you can give it over the scar tissue and you can give it over the joints to improve the range of motion. So then effleurage will help you to drain the fluid. So whenever you have any fluid, definitely when you are doing the technique, there will be increased in the circulation and the fluid will be present in that particular area. That's why we are using effleurage to drain the fluids. So like that. So each technique will have its effects and uses. You need to understand the effects and uses so that you can choose the techniques according to it. So cupping is helping you to loosen the secretion. So if the patient is having secretion in the chest area, then you can do cupping, vibration, shaking, all those things. So if you learn the theory, then only you will be able to choose the particular techniques for the particular massage. Is that clear? Okay, so now I'll give you 10 minutes time, each one of you. Okay, so we are not going into the break rooms. I don't feel like break rooms is helping a lot. So I will give you 10 minutes time. All of you just practice this technique over a pillow. Then if you find any difficulties, then we can discuss. Is that clear? So lie down, find out the correct positions, another thing. So if you have any of your brothers or sisters, you can ask them to help you as a model. Okay, so I hope you would have completed. So there was many doubts. I think I have answered all. If anything I have not answered, just ask me again. One question is like how to choose the technique. That means you need to know you have different types of techniques, that is stroking, effleurage, petrissage, then percussion, all are different types of massage techniques, and each massage techniques has its own uses. Uses means what is the effect it is going to produce. So that is called uses. So according to the uses, you need to choose the technique. So in case if you want to break any adhesion alone, that means the person is having a scar tissue and you want to break the adhesion, then you have to choose the techniques whichever is helping to break it. So break it means like skin rolling, you can do friction, you can do picking up, you can do ringing. All these techniques will help you to break the adhesion. Is that clear? So you can choose those techniques to break the adhesion. In case if you want to clear the secretion, then you can use cupping, vibration, shaking. So like that, every technique has its uses. So according to the condition, you have to choose the technique. No, you don't need to explain the technique you are going to use. It's enough. You can just say that I'm going to do circular kneading. Then you can do circular kneading. Then you will do a effleurage. Then you can say now I am going to do skin rolling. So it is enough like that. You don't need to explain what is that particular technique. Okay, so anyone has any other doubt? No, you don't need to follow the same sequence like how I have given in the slide. This is just an example. This is just an overall example. According to the condition, you can make your own sequence. But definitely you have to start with touch, stroking, effleurage. After that, you can have your own sequence. But in between every technique, you need to do effleurage. So it is not that how many techniques you are going to use. It depends on the condition only. So in case if you are just going to do massage to relax a person, then you will have n number of techniques. So you can use all the techniques. So normally in okay, practically when you treat a person, it depends on like half an hour of massage or 1 hour of massage, like that. So we don't have any set frequency, or we don't have any set technique. So depends on the condition, you can just do. So for example, if the person has edema, that is swelling, and you are going to do you are going to reduce the edema, then you have to do at least you have to do as long as you are reducing the effleurage little bit, reducing the swelling little bit. So all these are depending on the condition you have to choose. So you don't have any set number of techniques, or you don't have any frequency, you don't have any number of repetitions in massage. So stroking and effleurage, stroking is done very superficially, and it is done using the fingertips. Okay, so effleurage will be done using the hands completely. The stroking will be just done with the fingertips, and it will be done from proximal to distal, and it is done to relax a person, to make use to make your hands used to the patient, then to spread the lubricant. But effleurage is done to drain the fluids. So always effleurage is done from distal to proximal, or distal to towards the lymph node. Is that clear? Intermittent effleurage is not a type. You have to do effleurage intermittent to all the techniques. So that means in between all the techniques. So after circular kneading, effleurage, then go to the next technique. So it is like that. So uh, it is not a type. It is using the effleurage intermittently. Okay, so any other doubt? Okay, after this after I'm teaching your upper limb and lower limb, then we will go into the OSPI questions, or we will go into case scenario. Then I can explain you very clearly. Okay, so can we go to the next? Okay, I'll do the friction once again. Okay, why I have asked you to do friction 1 centimeter means, actually the spinous process will be arranged like this. So this is, if this is the spinal cord, sorry, this is the spine, you will have spinous process one below the other. So I hope you are remembering the anatomy. So the spinous process will be like this. The spine will be like this, and the spinous process will be protruding behind. So it will be one below the other in the gap of 1 centimeter. Okay. So can you see this? I hope you are able to see. So each spinous process will be down, or else I'll just mark here. Each spinous process will be in the gap of 1 centimeter. It will be protruding behind posteriorly. Okay. So that's why I have asked you to give friction in between in between 1 centimeter. Is that clear? Okay. So I'll just repeat this. So you can just imagine this is your spine, and the spinous process will be protruding like this. Okay. So you are coming from down. So you will palpate the PSIS. Then when you meet together in the middle, it will be at the S2 level. So at the S2 level, you just palpate. And if you feel the spinous process, then you can start giving circular friction. So since like in distance, you will not understand. So you can just palpate, and if you feel the spinous protrusion, then over the protrusion, you have to give it. Okay. So do some 4 or 5 times circular friction, then go up 1 centimeter. So when you go up 1 centimeter, you will palpate the S1 spinous process. Is that clear? Then you can do circular friction. Then go up 1 centimeter. So when you go up 1 centimeter, you will palpate L5 spinous process. Then over that you will give again 1 centimeter up, L4. Then again L3. Like that you will go up. So when you go 1 centimeter, you will exactly palpate over the spinous process. So that's why I asked you to do 1 centimeter. So same like that. Same like that. When you have a spinous process like this protruding, laterally you will be having 2 transverse process. So the bone will be like this, laterally behind. So it will be in the sides. So normally the spinous process will be posterior, transverse process will be in the sides laterally. Okay, so when you palpate the spinous process, come lateral, then come 1 centimeter down, so that, or half centimeter down, so that you will have the transverse process. Okay, so that's why you have to, from the spinous process, you have to come laterally 1 inch, then come little bit, half inch down. So that, half centimeter down, so that you can palpate the transverse process. Then after palpating the transverse process, come 1 centimeter down, so that you will come down to each transverse process. Is that clear? So from the spinous process, the transverse process will be protruding like this in the lateral side. So from here, you come laterally 1 inch, then come half centimeter down, you will have the transverse process. Then after that, you come 1 centimeter down, so that each transverse process will be there, and you will be able to give it. Is that clear? Can we go to the next? So next is for upper limb and lower limb. So upper and lower limb, generally it is both are same. So I will explain once. So before that, let me just tell you a little bit about upper limb and lower limb, little bit about the condition. So normally you will be giving massage for upper limb and lower limb to reduce pain, to reduce spasm, to relax the person, then to improve the skin tone and to reduce the skin tone. Okay, reduce the muscle tone or improve the muscle tone. So in the first semester, in the previous semester, you would have learned that you will be giving passive movement when the muscle power is zero or when the person doesn't have any muscle tone, isn't it? So when the person doesn't have any muscle tone, you have to increase the muscle tone. For that also you can do massage. And when a person is having increased tone, you have to reduce the muscle tone. So for that also you can do massage. Is that clear? So the conditions you will be giving massages to improve the muscle tone, to reduce the muscle tone, to reduce pain, to reduce spasm, to reduce edema. Okay, so for all these conditions, you can give massage. So only thing is, you have to choose how you are going to do the massage. In case if you want to reduce the effleurage, reduce the edema. In case the person is having edema and you are going to reduce the edema, then you have to do massage from distal to proximal. So distal to proximal means from fingers you have to start. So you have to start from fingers, then you have to go towards your shoulder. Is that clear? So from fingers you will start, then you have to go towards your shoulder and you will be draining all the fluids to the axillary lymph node. Okay, so or cervical lymph node. So this is to reduce the edema. In case if you want to increase the tone, that means the person has muscle power 0 and you want to improve the muscle power and you want to improve the muscle tone, then also you can start doing massage from distal to proximal, that is from fingers to arm. In case if you want to do massage, in case if you want to reduce the tone, the person has increased muscle tone and you want to reduce the tone, then you will be doing from proximal to distal. Is that clear? So the person has muscle tightness or increased muscle tone. You want to reduce the muscle tightness, reduce the muscle spasm. You want to reduce the muscle tone. Then you have to start from proximal to distal, from the shoulder to the arm. Is that clear? So this is how you want to differentiate. So I'm not telling about the upper limb. It is same for your lower limb. So I repeat again. So for limb massage, the conditions you are going to use will be pain, then reduced muscle power, reduced muscle tone, increased muscle tone, muscle spasm or tightness. Is that clear? Then last is edema. So you are having 6 conditions. One is pain. So if the person has pain, then you are going to use massage to relax the person. Okay. Then the person has reduced muscle power, that is 0 muscle power. You're going to improve the muscle tone. The tone is also less. So you're going to improve the muscle tone. Then for this too, you will be doing from distal to proximal. So to improve the muscle tone, to improve the muscle power, to reduce the edema, all 3 conditions you have to do from distal to proximal. That is from fingers to shoulder. Okay. So for pain, you can choose anything. You can do from distal to proximal or proximal to distal. Anything you can do. Then next is to reduce the muscle tone. To reduce the muscle tightness, you have to do from proximal to distal. Is that clear? So this is same for both upper limb as well as for lower limb. Then depending on the patient's body, that means if the person has very bulky upper limb, then you can divide anterior side, posterior side. Okay, that means you can make the person to be in supine lying, give for the anterior side, then position the patient in prone lying and give for posterior side. Is that clear? But if the person's hand is very light, that means like the person is very thin, then you can just lift the hand and do the massage. So you can just see, you can position the patient in prone lying. Okay, position the patient in prone lying, and if this is his hand, okay, so you can just hold the hand like this and you can do massage with one hand itself. You will be able to do massage in all the sides. But if the patient is bulky and if the hand is very heavy, you can't lift it for half an hour like this. So in this case, you can position the patient in supine lying, do all the techniques in anterior side, then position the patient in prone lying, do on the posterior side. Is that clear? So depending on the patient's heaviness, on bulkiness or patient body weight, you can decide how you're going to divide the technique. Okay. Then one more. If the patient is a child and if you're able to cover up completely, then you can cover up completely. That is, lift the hand, start from fingers, you can do complete effleurage. Okay, but if the patient is big and has a lot of space to cover, then you can divide all the fingers first, then from wrist to elbow, then elbow to shoulder. So you can divide the area. Same like that in the legs, you can finish off the foot, then from the foot, from the ankle to knee, then knee to thigh. So you can divide like that. Is that clear? Is that clear, everybody? Or should I need to repeat again? Okay. See, okay. Somebody wants to repeat and somebody wants to don't want. Okay, I'll repeat. So depending on the condition, you have to choose the technique. So condition is, you have nearly 6 conditions for the upper limb. One is pain, reduced muscle tone, reduced muscle power, edema, increased muscle tone, muscle spasm or tightness. Is that clear? So for pain, you can choose the technique. Either you can do from proximal to distal or distal to proximal. You can choose anything. Okay. For edema, for reduced muscle tone, for reduced muscle power, you have to do from distal to proximal. You have to do from distal to proximal. Is that clear? Okay. Then for increased muscle tone and you want to reduce the tone, for the muscle tightness and you want to reduce the muscle tightness, you have to do from proximal to distal. Is that clear? You have to do from proximal to distal. Proximal to distal means from the shoulder to hand. Distal to proximal means from the hand to shoulder. Is that clear? Okay. Next is, depending on the patient body weight, you can divide the technique. So if the patient is very thin and you are able to lift the hand, then you can just lift the hand like this, hold the hand with one hand, then you can do massage in all the areas and you can complete. But if the patient is very bulky, then you can make them to be in supine lying, keep the hand over the pillow, do massage on one side, then position the patient in prone lying, do massage on the other side. Is that clear? Then, if the patient body is very big, then you can also divide into segments. So, one is hand segment, then from wrist to elbow, then from elbow to shoulder. So, segment wise also you can do it. So, this is how you are going to divide according to your convenience and the patient convenience. Okay, especially this is for our convenience. since we are not able to lift the patient for a very long time, we are dividing like that. So this is for our convenience. Hope everybody are clear. Can we go to the technique? Okay. So here I have just shown you the share the screen regarding the arm massage. So effleurage is done 3 times. Then you can use circular kneading, hacking, picking up, compression, then wringing, then friction over the bony areas, all those things. Okay, so again here, depending on the condition, depending on your need, you can choose whatever techniques you want to do. But you are going to start with stroking, then you are going to go for the next thing. And in between each technique, you are going to give this effleurage. Okay, so in between each technique, you are going to give effleurage. So this 3 times effleurage is to make sure that you are covering up the whole area. If the area is very thin and you are able to cover with one itself, then you can reduce this number of times. And if the area is very big, you are not able to cover up, then you have to increase this times numbers. Is that clear? So we don't have any set number of times. Okay. Now, so you can just imagine that you have positioned the patient in supine lying, and this is hand. And this is hand. So just for easiness, you can either hold the hand in your in one hand, or you can just keep a pillow and position the hand little bit slanting so that it is easy for you to drain the fluids. So especially when you have edema, you have to keep it over a pillow, keep the hand over a pillow like this, so that you are draining from little bit higher side. Okay, otherwise you can also just hold the hand in your fingers and you can do. Is that clear? Okay. So now, 1 minute. Okay. So first we will start from distal to proximal. So first here you will be applying the powder. Then after applying the powder, you will be doing something stroking. So stroking is okay. Stroking is just with the fingers. You can do from shoulder till the hand. Okay, so do here. When you're going back, it is just a touch. Then come, going back, just a touch. Come like this. So you have to do stroking all over the area. Okay, if the area is bulk, then you can divide. So you can also divide like from shoulder to wrist. Sorry, shoulder to elbow. Then you can complete all the techniques over here. Then come to the forearm part. You can also do like that. Okay, now I'm going to show you the complete one. So stroking from shoulder to hands. So you have to do stroking. Then you can start effleurage. So effleurage from fingers, then drain to the arm or cervical node. Okay, like this. So if you want to use the thumb also, you can use it. So you can use the thumb. If the area is very thin, then you can use the thumb and drain it. You can also use the forearm to do the technique. You can also use the fist to do the technique. Okay, so anything you can use it. Then after effleurage, you can go for circular kneading. So circular kneading is like this. Okay, you can do hacking. Hacking is this one. Then you can do picking up, then compression. I think I don't need to tell you the technique, right? I just tell you how to do. So let me just explain from using my hand, other hand. So you will be holding the hand like this. You will start with stroking, then you will do effleurage. Okay, so after doing effleurage, the other technique, the different technique is kneading of the fingers. So the fingers you need to knead like this. This is called spiral kneading. Okay, so this will help you to drain the fluids from the fingers. So hold the hand like this. Okay, then just spirally knead it. So each finger you need to do the spiral kneading. Okay, each fingers you need to do the spiral kneading. So after doing spiral kneading, imagine the fluids will be here because you are just pushing the fluids till this area. Then from here, you need to do the effleurage and you have to drain. So when the hand is very bulk and you want to divide into segments, then from the fingers you will drain here. Then from here you will be draining to the wrist. Okay, you can do effleurage and drain all the fluids to the wrist. Is that clear? Then after that you can go for friction. So friction you will be doing over the bony area. So you will be doing the circular friction on all the bony areas. Okay, you can also do transverse friction, parallel or perpendicular, whichever you want you can do it. So after friction again you can do effleurage. Then after that, here in the hand you can only do wringing. So you can do wringing over this area, this area. Okay, so over the muscles you can do wringing. Okay, then after that massage. So only this three technique you can do in the finger, in the hand, that is spiral kneading, friction and wringing. Okay, so this three only you will be able to do in the hand. Then effleurage. So only four techniques you will be doing in the hand. After that, so you have completed the hand part. Now from the hand, from the wrist, you are going to do to the elbow. So from here you are going to drain it into the elbow. Is that clear? So from here, this part, you're going to drain it in the elbow. Then you can go for circular kneading. So here you can go for finger kneading because you don't need to put the whole hand. You can go for finger kneading. You can also do thumb kneading. Okay, you can also do fist kneading. Anything you want, you can do. Then after kneading, again effleurage from the wrist to elbow. Then after that, you can go for hacking. Hacking you can do only over the muscle area. Okay, you don't need to do. So on either side of the forearm, this area and this area, you can do hacking with one hand. Okay, then you can do picking up. You can do picking up. So everything from distal to proximal. In case if you want to reduce the muscle tone and if you want to reduce the muscle tightness, then you can do from proximal to distal, from here till here. Okay, so like this. Is that clear? Then after that, effleurage. Okay, then you can go for compression. Use both the hands and do compression. Okay, then okay, only this much you will be able to do. Then from same thing from elbow to shoulder. So you have to do from elbow to shoulder and drain it in the armpit or drain it in the cervical. Then you can go for circular kneading, hacking, wringing you can do on both the side. You can do picking up on both the side. Then you can give compression. Is that clear? So Same thing you will be doing in the lower limb. So same thing you have to do the spiral kneading in the toes. So in the toes you will be doing doing the spiral kneading. Okay, after spiral kneading you can drain it over the ankle. You can do this effleurage and you can drain it in the ankle. Then you can go for friction. Then you can go for bringing. Then you can go for hacking. Hacking also can be done in the foot. Is that clear? So bringing, hacking you can do in the foot since it is having muscle. But if the patient is very thin, doesn't have any muscle, then you cannot do it. You can do only friction and spiral kneading. Then from ankle to leg you will do. Then from leg to thigh, knee to thigh you will be doing it. Is that clear? See, depends on you. If you are able to hold the patient's hand like this throughout your technique, then you can hold it and do on all the sides. If you're not able to hold, then you can do finish of the anterior aspect, then turn the patient and do on the posterior aspect. Okay. Then effleurage is always from distal to proximal. Never mind whether it is spastic or whether it has less muscle tone, it's not an issue. So effleurage will be always from distal to proximal. Only other techniques you will be decide whether to do from proximal to distal or distal to proximal. Okay, dividing the patient's body anterior and posterior or dividing the patient body into segments, it depends on yourself. It is for the therapist convenience. So you can decide whether you want to do divide and do, or you want to do it together. Depends on your body stamina and your ability to hold the patient. Exactly. So that doesn't change according to the condition. Sometimes if the person has a very bulky area, you can also do skin rolling if it is needed. According if the person has adhesion and other thing, then you can do that. Okay. See, effleurage is always from distal to proximal only. No matter, only the other techniques you will decide to proximal to distal, because effleurage is to drain the fluids to the lymph nodes. So you need to give from distal to proximal only. You should not give from proximal to distal. Okay, so I'll give you some 15 minutes time. Can you practice? Then we can discuss in the last 10 minutes. Okay, so I'll give you take 10 minutes for upper limb and 10 minutes for lower limb. Then we can have a discussion in the last 10 minutes. Don't waste time. You practice on a pillow or anything is there available. Okay. Do you have any doubt? Okay, you want me to repeat any technique? Anybody wants me to repeat any technique? Okay. So the thing is, for the fingers and the toes, you cannot do effleurage to drain the fluid. So that's why you are doing something called spiral kneading, and you are draining the fluid. Okay, so here in the fingers, you need to do this. You have to hold the finger and twist spirally. That's it. Twist your hand spirally. This is called spiral needling. So after doing 3 or 4 times in each finger you have to do 3 or 4 times. You have to hold the fingers like this, then you have to do spirally. Okay. So after doing 3 or 4 times, all the fluids will be coming and present here. So from here, you have to drain to the wrist. In case if you are dividing into segment, you have to drain to the wrist with your fingers. Okay, so you can drain to the wrist. You can also use your thumb to drain. Okay, so you can also use your thumb to drain to the wrist. In case if you are deciding to drain till the shoulder, then you can drain till the shoulder to the axilla. Okay, so you can just drain till the axilla like this. If you are dividing into segment, then you drain to the wrist, then wrist to elbow, elbow to axilla. Is that clear? So you can use the finger effleurage. You can also use the thumb effleurage to drain it. Is that clear? I hope you remember the types of effleurage. So you have one hand effleurage, two hand effleurage, ulnar side effleurage, thumb effleurage, forearm effleurage, and fist. So depending on the area, you can you can choose which type of effleurage you want to do. So same thing you have to do in the toes. So you have to do the spiral kneading in the toes. Then after from the metatarsal, so from the toes you have to drain till the metatarsal. Then from metatarsal you can drain till the ankle. Is that clear? So from the metatarsal you can drain till the ankle. So you can decide you want to use fingers or you want to use thumb. Okay, so you can drain till ankle, or if you want to use the complete, then from the metatarsal you have to drain all the fluids to the thigh completely. Is it clear? So you have to drain till the inguinal knot. But in the leg part it is very difficult, so you can divide the leg part into segment. So from the toes you will do spiral effleurage and you will be draining to the metatarsal. From the metatarsal, you drain to the ankle. Is that clear? Then from ankle to knee, knee to thigh. Like that you can divide. So you can use any of the effleurages like this. So am I clear? Okay, so do you have any other doubt? Okay, do you have any other doubt? Okay, so my next plan is like we have few of the case scenarios. We have to discuss on that case scenarios. Then I will ask you to practice like that. So do you want? I think maximum I'll be needing only 1 hour. So do you want to continue now itself? or tomorrow I will take 1 hour and I will ask Miss Vani to continue with the remaining. How you want to do? Okay, so tomorrow I think we have 3 to 5, right? So I will take first 1 hour, and then if we have completed, then I will ask Miss Vani to continue. Okay, so I think we have, like, I have given uploaded the handbook in LMS. You just download it, and you go through the case scenario. The scenarios are in the handbook. Is that clear? So you have to download the handbook for the case scenarios. So I'll upload this new slide now, and I'll try to upload the recordings, everything by today. Is that clear? Okay. Any other doubt? If no doubt, then we can wind up the session. Okay. Thank you all.